They show that love, that passion. Mama, does it mean that you don't need to have haircut anymore? The time left, how they want to utilize. You will end up with big disasters, and even if there's hope, you won't be able to see that hope. Every day struggling, keep pushing you down. You need someone to tell you you're okay. So we managed to get a meeting, but arranged outside of the hospital. So that's how I changed my approach. I managed to go to a hotel. I got her kids there, her family members, thinking that we are just having a meetup. And over there, I disclosed the news. You can imagine how it must be for a family, for her kids, and her daughter, who's almost college going girl, and a young son. The moment they heard that, the family, first there was a face, what, how she didn't involve us, why, why no trust. And after she was trusted, everyone came. They showed that love, that passion, the way we're there for you from A to Z. Doesn't matter about the time, how much is left. We will be together. That feeling I cannot show you. But I still remember that she started getting her psychological support, emotional support, family support. Her daughter started doing GoFund to collect charity for her treatment. That was a big step. So her son, I remember him saying one thing. He was young and he didn't know what all this is. He didn't know about chemotherapy. But he said, Mama, does it mean that you don't need to have haircut anymore? So these are some things which we really, need to understand, that some cases which touch us are those who are alone. We need to be there for them. And again, coming back to, there are some things we should be talking about openly. So this is another part. When people are coming in and they're talking to us, we should, as a doctor, encourage them. We should tell them what are the things they should be openly discussing. For example, a patient who's been diagnosed. For some patients, I think it's important for them quality versus quantity. So if someone is at end stage of cancer, though I think Nusrat would know better, at end stage, when you know that treatment is limited, some of the families or the patient themselves, they need to be in peace of mind. They need to know that, the time left, how they want to utilize. Some will say, I want aggressive treatment with chemo. Then you know the plan, what to do for them, because that will give them peace of mind. But other way, some will say that no, we just want to be taken care of. So you give supportive treatment. You make sure that those patients get love, comfort, the way they're getting treated. You take care of their symptoms, but you don't push them towards too much side effects. Do you know, Nusrat, there are some myths in our society, so many myths. So can you clear those to our people? See, mostly there are certain things. When you wear the perspirants, or you're wearing perfumes, you're wearing tight bras, or your breast is small, all these things can cause cancer. Do you think that is any fact or truth to it?
No, it's totally wrong. There is nothing in this that wearing tight bras or putting perfumes, or one breast is small and one breast is large.
But then people also think that if, for example, you have family history, that's the only way. So
this all, no. This is not a myth. Family genetics and one breast small, one breast large. There is little relation to the breast cancer only if from the beginning one breast is small, one breast large. Then they develop a cancer. It is a myth. But if somebody have both breasts is equal and suddenly one becomes small and one gets large, yes, there can be the chances. It's not necessarily cancer. We can say breast disease.
And one more thing. Usually, if you heard, they say that patients will develop this in old age or middle age. Yes, higher patients, but don't say. Just now she told about 26 years old. You're finding cancers in a very early age now. So young girls need to be aware how to do examination, how to get approached earlier. That's important. And then there's a myth also regarding what was that? I came across, family history I wanted to tell. Only 7 to 8% with BRCA genes will be having this in the family. So all the others are not related to the genes. So if you don't have family history or you don't have BRCA genes, doesn't mean that you don't. If you're a woman, you're growing, and you're, the second important is obesity. These three things are